Hi, my name is Victoria Hill, and I will be discussing my literature review on organ transplantation during the COVID-19 pandemic, impact on deceased organ donor referrals, and consent rates in the Western Cape, South Africa. So basically, this article focuses on providing a report on the influence that the COVID-19 has had on deceased people donation for transplantation in South Africa. So according to the authors of the article, different individuals donate organs in South Africa, which I found very interesting. So we know the living and the dead can donate organs, but the authors stated that only the dead can donate organs like the heart, lungs, pancreas, cornea, and tissues. So basically, the liver and kidney transplants come from the living, while the heart, the lung, the pancreas, the cornea, and tissue transplantations comes from the dead only. Because of this, they stated that one dead individual can benefit various patients in various ways because the deceased will donate multiple organs to different people. However, when there is a reduction in deceased organ donation, a decrease in organ transplantation also occurs because resources had to be balanced to cater to the COVID-19 patients in 2020 to help reduce the COVID-19's burden. So basically, they tested in this particular study is the effects that COVID-19 had on such deceased donations, and it will involve comparing the 3 years before the pandemic and the 10 months of the pandemic. To review the donation consent rate of the deceased, the authors reviewed, they collected data from 2017 to 2020. The activity covered all private hospitals in Western Cape and all state hospitals around Cape Town. After the data was collected, a review was conducted on whether or not the consent was granted in the organs that were assented for. The data was then analyzed in a password-secure database and summarized as frequencies and proportional. So after this data was analyzed, different results had arrived. So these results were provided in different categories in the article, such as referrals and consent rate. So as indicated in the article, before the pandemic began, there were many deceased donors in public-private hospitals around Cape Town. With the highest being around 201, in Western Cape Province being the highest number. Although the rate kept changing, the percentage remained higher, ranging between 59 to 69 referrals yearly. However, during the COVID-19 pandemic, this number significantly decreased. The public sector only had 1.8 referrals, while private hospitals had 6. So this was around a 63% decrease with 1.8 mean monthly referral rates. So also a significant decrease was observed during the COVID-19 pandemic compared to the period before the pandemic. According to the author, although the distribution was maintained across the COVID-19 period, the results remained constant. So although the authors acknowledged a noticeable decrease in referrals and consent rates, especially after the COVID-19 pandemic, they argued that the pandemic itself might not have caused a reduction, such as occurrences on decrease in trauma charges, healthcare seeking behavior alterations, reduction in family checkups, and the fact that most potential donors tested positive for COVID-19. So that made it a bit difficult for other processes to take place without causing severe effects. Also, various hospitals, they initially used different machines and resources in organ transplantation. So during the pandemic, most of the resources and materials became helpful, in other words, to help save different individuals' lives. This led to resource and material reduction, also a reduction in the number of referrals. So according to the articles, this did not happen only in South Africa, but in other regions, such as the United Kingdom, USA, and Australia. These countries and more are said to have experienced the same amount of reductions. However, They suggested that in South Africa, the lack of good quality information on various medical care aspects had been highlighted by the pandemic, and there is a great need for improvement in the capturing of data to inform healthcare. As they concluded their discussion on the results achieved on their research, they offered various limitations. One such restriction they provided is that they could not comment on whether or not the deceased donor's decrease resulted from the rapid growth of the waiting list, as there was no collection on organ transplants waiting lists. So, according to the authors, the pandemic highlighted a need for better data to inform the public about the decisions made concerning health matters. Also, it became significant that there was a decrease both in terms of donors and referrals, but the pandemic didn't directly cause it. They also provided strategies that help improve the donation and transplantation of organs during and after COVID-19 were highly required. So that will conclude my literature review presentation. Thank you. Have a nice day.